Hi everybody, welcome to Dr. Manny's Learn Shops. In this presentation we're going to review immune diseases, in particular autoimmune diseases, look at immunity suppression, organ transplantation and multi-system failure. An autoimmune disease is basically a condition where the immune system mistakenly doesn't recognise its own body and it attacks it and starts destroying it even though it's meant to be protecting it. Currently, there are about 80 types of autoimmune diseases and they are rising as medical science discovers. In an autoimmune disease, the immune system releases proteins called autoantibodies. An antibody is anything that attacks an antigen or something that shouldn't be there. But an autoantibody is now attacking what it shouldn't be attacking, that is healthy cells. Some or more autoimmune diseases target only one organ, like in diabetes mellitus type 1, it damages the pancreas. However, in other more horrific disorders such as lupus and systemic lupus erythematosus, it can attack the whole body. Joints, heart, bones, kidney, liver, pancreas, and so forth. What's the etiology of autoimmune diseases? Well, an autoimmune disease is essentially idiopathic, which means the academics, the scientists, don't really know. But again, what makes you more susceptible to acquiring an autoimmune disease are the following: gender, women higher compared to men; age, race, exposure to certain environmental toxins, a Western diet, and hereditary and genetics. There's even something called the hygiene hypothesis, which means that people are not exposed to certain germs and their immune systems may not recognise their own body parts. And this may react in overreaction and be a harmful trigger. Things like vaccines, antiseptics, commonplace interventions that we have today. As I said, there are more than 80 different types of autoimmune diseases. I've just listed what I consider the 12 most common ones, that being diabetes mellitus type 1, rheumatoid arthritis, systemic lupus erythematosus, multiple sclerosis, hypothyroidism or Graves' disease, hypothyroidism or here Hashimoto's thyroiditis, hemolytic anemia, inflammatory bowel diseases like Crohn's, Addison's disease, myasthenia gravis, celiac disease and Guillain-Barré syndrome. We're going to briefly review some of these autoimmune disorders. So the first one is type 1 diabetes mellitus. In type 1 diabetes mellitus, the immune system antibodies, the autoantibodies, attack and destroy the hormone insulin producing beta cells in the islets of Langerhans in the pancreas. And without insulin, glucose builds up, hypoglycemia. Hypoglycemia essentially will damage blood vessels and organs in the microcirculation, like in the heart, the kidneys, the eyes, the nerves, which can result in cardiac issues, kidney failure, blindness, and peripheral neuropathies. These individuals need insulin injections to survive. Then you've got rheumatoid arthritis. Rheumatoid arthritis is a chronic inflammatory autoimmune disease which occurs when the immune system mistakenly sends autoantibodies to the linings of joints and attacks its own healthy body tissue. In some people, this disorder can affect more than just joints. It can also damage other body systems. Any autoimmune disease can create and affect any other body system, so that if you have one autoimmune disease, you may be at risk of developing another. Then you have lupus. Lupus is a chronic idiopathic meaning they don't know, autoimmune disease, which causes inflammation of the connective tissues. It can affect one organ or it can affect many organs. Lupus often mimics the symptoms of some other conditions such as fatigue, being tired, joint pain, swelling, rash, fever, which are generic clinical manifestations. 90% of lupus patients seem to be women, especially young women. They don't know, it's idiopathic. But there seems to be a genetic predisposition for autoimmune diseases, especially if they've occurred previously in other family members. Then you have multiple sclerosis, also known as encephalomyelitis disseminata. This is an autoimmune disease of the brain and the spinal cord, the central nervous system. And the immune system attacks the protective sheath, the myelin sheath, that covers nerve fibres and causes communication problems between the brain and the body, meaning that here the neuromuscular connection, junction, is affected. And eventually the disease causes permanent damage or deterioration of nerves. Signs and symptoms vary. It depends on the amount of nerve damage and which nerves are affected. Some people with severe multiple sclerosis may even lose the ability to walk independently. And like all autoimmune diseases, there is no cure. Then you have Graves' disease, which we covered previously in another Dr. Manny's Learn shop. Now, Graves' disease, hypothyroidism, is also an autoimmune disease where the autoantibodies attack the thyroid gland in the neck and cause it to overproduce thyroxine. And without treatment for hypothyroidism, this can lead to severe complications which can result in heart failure, osteoporosis, and even death. Hashimoto's thyroiditis is also an autoimmune disease, and this results in hypothyroidism. The most common cause of hypothyroidism is Hashimoto's disease, and this results in fatigue, goiter, weight gain, hair loss, and cold sensitivity. It typically affects middle-aged women, but can affect any age group, whether they be children, men or women. And the treatment here is to replace thyroxine. Then you have hemolytic anemia. Hemolytic anemia can happen when the immune system fails to recognise its own erythrocytes and destroys them. And this destruction leads to anemia, which causes symptoms such as shortness of breath, dizziness, headache, cold peripheries, fatigue, jaundice, noted in the eyes and the skin, and cardiovascular problems such as heart failure. Then you have inflammatory bowel diseases, such as ulcerative colitis and Crohn's disease, to name a few. And experts, academics, medical professionals, think bacteria in the digestive tract can mistakenly be recognised and trigger the immune system, which causes this inflammation. But again, as with all autoimmune diseases and disorders, it's idiopathic. They don't know. They can only make assumptions, scientific calculations, and estimations and predictions. When it comes to Addison's disease, which is adrenal insufficiency, this is an autoimmune disease that affects the adrenal glands. And the adrenal glands, remember, produce hormones such as cortisol and aldosterone, as well as numerous androgen hormones. And basically, it's the adrenal cortex that is damaged. And when 90% of the adrenal cortex is destroyed, the adrenal glands won't be able to produce enough cortisol and aldosterone. And aldosterone deficiency will cause hyponatremia and hyperkalemia. Symptoms include hypoglycemia, weakness, fatigue, and weight loss, to name a few. Then we have myasthenia gravis. This is a chronic neuromuscular autoimmune disease where the autoantibodies are produced that block or destroy the acetylcholine receptors. And as a consequence of that, there's reduced transmission of the impulses from the nerves to the muscles. And this leads to weakness and fatigue of the muscles. The most commonly affected muscles are those in the face, in the neck, which involve eye movements, and importantly, swallowing, which can affect your protective reflexes, such as your swallowing reflex, and it can affect the lower limbs as well. Typically, on physical assessment, you see drooping eyelids, ptosis, double vision, trouble talking, dysarthria, and problems with walking. Another disease that is an autoimmune condition is celiac disease. And this is when the autoantibodies mistakenly attack healthy tissue. As with all autoimmune diseases, there's no cure. The only thing that can be done in this condition is dietary. And here the immune system mistakenly attacks the small intestine if there is gluten in the small intestine. And as a consequence of that, when it attacks, it damages the surface of the small bowel and interferes with the body's ability to absorb essential nutrients in the small bowel. The cause, again, is idiopathic, unknown. But theories go that it's related to genetics and the environment. So the people with celiac disease, if they eat gluten, which is a protein that's found in wheat, rye, barley, and other grain products, the immune system responds by attacking the small intestine, which causes inflammation and damages this part of the gastrointestinal tract. Some of the common clinical manifestations are weight loss, diarrhea, bloating as a consequence of gas buildup, abdominal pain, nausea, vomiting, constipation, and fatigue. The last one that we're going to be reviewing is Guillain-Barré syndrome, which is rare. It's a rare autoimmune disorder where, similar to myasthenia gravis, the immune system damages the nerves, and as a consequence of that causes muscle weakness and paralysis. It's idiopathic again, and this can result in the rapid paralysis of the whole body, which means that you won't be able to breathe. Some treatments could be, as with most, could be now plasmapheresis to try and reduce the number of autoantibodies in the blood system, in the circulatory system, in the plasma. But the autoantibodies are continually being produced because they are part of your immune system and they're normal, but they're attacking parts of your body which it doesn't seem to recognise. What are some of the symptoms of an autoimmune disease? Well, it depends, but they do share similar symptoms. Commonly, early fatigue, joint pain because of inflammation and edema, rashes, other dermatological problems, abdominal pain or digestive issues, things like nausea, vomiting, diarrhea, constipation, a low-grade recurring fever, which may be related to the inflammation, numbness and tingling of the hands and feet, peripheral neuropathies, hair loss, swollen glands. But specific diseases have their own unique symptoms. So for example, in diabetes mellitus type 1, this can cause polyphagia, extreme thirst, unintentional weight loss, fatigue. In irritable bowel syndrome, this can cause abdominal pain, bloating, diarrhea, even constipation. What are some of the risk factors to acquiring an autoimmune disease? Well, genetics, being overweight, smoking cigarettes, possibly even alcohol abuse, and certain medications that have adverse reactions. How do you diagnose it? Well, you sort of can't really. Diagnosis is probably going to be related to history and physical assessment because there's no single test that can diagnose most autoimmune diseases. As I said, history, clinical manifestations, and the physical examination. There are anti-nuclear antibody tests that can be done, but it just indicates that you may have an autoimmune disorder, but it doesn't confirm which disease. Other tests do look for specific autoantibodies, which can be produced by certain autoimmune diseases. And there are numerous. When it comes to the treatment of an autoimmune disease, well, there isn't. There's no treatment and there's no cure for autoimmune diseases. But you can control palliative care, you can reduce inflammation, non-steroidal anti-inflammatory medications, maybe steroids, analgesia, and again, lifestyle modification. So eating a well-balanced diet, getting regular exercise, but there is no treatment specifically that can cure an autoimmune disease. When we look at organ transplantation, there are issues related to immunity again. But organ transplantation is a medical surgical procedure in which an organ from a donor is removed from one body and placed in the body of another person called the recipient. And this is to replace a damaged or a missing organ. Types, numerous now, even more, but we can have corneal, tracheal, heart, lung, liver, pancreas, kidney, bone, skin as transplantations. Okay, when it comes to organ transplantation, remember, the organ doesn't belong to you. It comes from someone else, which means if your immune system is working effectively, correctly, it should attack and destroy the recipient organ that's been transplanted. And each person's immune system reacts differently to transplanted organs. Transplanted organs, allografts, mean the allografts are from someone else. Autografts are from you. For example, you could have skin transplanted from one area of your body to another part of your body. You could have bone transplanted from one part of your body to another part of your body, and it won't be an issue. But if you have skin from someone else's body, tissue valves from someone else's body, then it will become an issue. So even if the tissue types are matched, transplanted organs will be rejected unless measures are taken to prevent the rejection. Every transplant has got some degree of organ rejection, but the degree of rejection is often not clinically significant because of the medications that the patient is taking to trick the immune system, their immune system. So rejection can be controlled by immunosuppressants, which suppress the body's immune system. But however, if you've had a heart transplant, liver transplant, eye transplant, whatever transplant, the immunosuppressants have to be taken for life. Immunosuppressants fall into three diverse classifications. Calcineurin inhibitors, which inhibit the enzyme that activates your T cells, which originally came from the thymus gland. Anti-proliferative agents, which reduce T cells and B cells, or T and B lymphocytes, which reduce the cytotoxic response attacking the organ. Or you can have corticosteroids, which inhibit leukocytes, make them not as effective. Or you can have common immunosuppressants, such as prednisolone, tacrolimus, cyclosporin, mycophenolate, mofetil, and imurin. And there are numerous others. Now let's look at multi-organ dysfunction syndrome. Remembering multi-organ, which means many organs are involved, or certainly two or more. Syndrome is a predictable pattern, dysfunction not working properly. So multi-organ dysfunction syndrome is a systemic inflammatory response. It's got a high mortality rate because it can affect numerous organs, and if it affects organs like the heart, the lungs, the kidneys, the liver, this can be life-threatening and have a high mortality rate. Early recognition is always important with everything. And in this syndrome, early recognition, early intensive care is important. And to support the organs that are being affected. So if the heart's being affected and they're in heart failure, we need to increase myocardial function. If the kidneys are affected, then we have to take over the role of the kidneys. If they can't breathe properly, then they have to go onto a ventilator after being intubated and ventilated, and so forth. When it comes to the etiology, the cause, the pathophysiology related to multi-organ dysfunction syndrome, it can be any disease, any disorder, any injury as a consequence of now causing tissue injury. This can be shock, sepsis, major polytrauma, severe burns, pancreatitis, disseminated intravascular coagulation coagulopathy, also known as DIC, aspiration syndrome, where gastrointestinal contents are aspirated into the lungs, or saltwater and freshwater drowning, extracorporeal circulations like cardiopulmonary bypass, multiple blood transfusions, ischemia and reperfusion injury after possibly being on cardiopulmonary bypass, any autoimmune disease, any heat-induced illness such as heat stroke, preeclampsia, eclampsia, any form of poisoning or toxicity, all can result in multi-organ dysfunction syndrome. What are some of the clinical manifestations? Well, it depends. It depends on which organs are affected. If it's the central nervous system, altered mental state. Kidneys, renal deterioration. Pulmonary, respiration deterioration. Circulatory, cardiac deterioration, and maybe even cardiovascular deterioration. Unstable metabolic status, variable fluid balance. Shock is a very, very significant cause of this syndrome. Now, when it comes to the management of multi-organ dysfunction syndrome, it can be very difficult. Not that I know, but this would be a critical care physician and intensivist. But the important thing would be it has to be identified pretty quickly because it can be fatal very, very early. If you want positive patient outcomes, they rely on immediate recognition of the problem, admission to an intensive care unit, and invasive organ support, which basically could be mechanical ventilation, could be certain medications, inotropic support, could even be things like extracorporeal membrane oxygenation, certainly continuous renal replacement therapy. Now, the management and treatment include identifying and treating the underlying causes, comorbidities the patient may have, any complications, and again, fluid resuscitation to increase cardiovascular perfusion. Support and care involves multi-organ support, regardless of what organs they are, vasopressors, mechanical ventilation, maintaining fluid homeostasis, and renal replacement therapy. And even as I mentioned previously, things like VA, venous arterial ECMO, extracorporeal membrane oxygenation, sometimes even VV, veno-venous ECMO, extracorporeal membrane oxygenation, which all can be reviewed, if you choose to, in other Dr. Manny Learn shops. So let's review now. Name one autoimmune disease. And the one that I'm going to mention is diabetes mellitus type 1, because it's probably the most common. What is the definitive treatment for an autoimmune disease? Well, there isn't one. There's no definitive treatment for any of the autoimmune diseases. It's really probably going to be palliative and treat whatever problems, clinical signs and symptoms the patient may be experiencing, but certainly lifestyle modification. Thanks again. Check out any of the other Dr. Manny Learn shops if you think these have been of any benefit to you, and please subscribe if you consider that they are beneficial, because that will allow you to be able to access other Learn shops that might come online.